Hello again, I'm Tim Spector from the Zoe COVID study, and this week we're going to be covering the latest numbers, an important methodology update, some awareness of the latest symptoms, and the question of whether the NHS COVID-19 app, the track and trace one, is actually working. So let's look at the overall numbers, and our best estimate using updated methods are that we now are seeing an estimated 60,000 new cases of symptomatic COVID daily, and that's giving us an R value of 1.1. And roughly 36,000 of these people have been unvaccinated, and just slightly under the half have had a vaccination, and that's roughly splits into a group that had 2 doses and a group that's had 1 dose. And this graph really provides new evidence that the vaccines are working, and the caveat is there's way more people fully vaccinated than with only 1 dose. So it's expected that the number of cases between the two groups would be similar, but the actual risk is very different. And we can give you this detail now because we've revised our methodology. But before we move on, really want to address the elephant in the room. Last week I reported that we were seeing a plateauing in the data, and this was based on methods that included a diminishing number of unvaccinated individuals reporting in our data. And the lack of unvaccinated people is a problem across all the COVID-19 surveillance studies, and we should also be cautious about the number of official government confirmed cases, given the fact that the UK is now testing 3 times more people than the next nearest country, and also has rather different criteria for testing than others, and so may also be missing lots of cases with non-classical symptoms. So the drop we saw in the unvaccinated cases ended up, which was based on small numbers, reduced our overall estimates. And while it was accurate in our data set, it wasn't representative of the UK picture. So we've now updated our methodology estimates and adjusted the figures for a number of factors, which we're going to explain in more detail shortly. And as a result, we're now very convincingly showing cases still rising in both the vaccinated group, which was always the case, but now also in the unvaccinated groups. Now the graph shows how our updated methodology now aligns with the other surveillance studies, and it is quite a different picture than the one I painted last week. But as one of the UK's leading studies into COVID-19, it's our responsibility to constantly review how our survey works to keep pace with the changing situation on the ground, and we're giving you this in real time, and I'll deliver those results faster than any of the other methods. So let's now look at the methodology update in a bit more detail, just to keep you up to speed. So we understand that many people do rely on us and our data to understand what's going on in the UK, and we do take this role very seriously indeed. And that's why the team at Zoe, working with your data, have been working around the clock to update the test and look at this new methodology to make sure that we continue reporting on these incidence figures for the UK with confidence. So what's new? Well, we now adjust the data by both age and vaccination status, which we weren't doing before. We're adding in age-related data, and this helps us to control the high proportion of older contributors and vaccinations in our particular data set. It also helps us to take into account that younger people are more likely to be unvaccinated and currently more likely to be infected. We're also including, for the first time, lateral flow tests, these LFTs, in our incidence rates. And previously we've only included PCR tests, but now these lateral flows are so widely used that we felt it was time to start including that data to make it more comprehensive, and we think that these are going to be increasingly used in the future to get ideas of what's going on. So currently the tests that our users are reporting are equally divided between lateral flow and PCR. And you can read more about these changes in our blog. Now, we know that the COVID situation in the UK and around the world is constantly evolving, and it will soon reach a point where unvaccinated people will, of all age groups, will be too low to really report COVID incidence estimates for this unvaccinated proportion of the population. And based on the current rates of vaccination, this is pretty inevitable, and it could happen in the UK within a few weeks. And as a study, we've reached this point earlier than some of the other surveys because the population that's on the app are more likely to get vaccinated early than other groups. They're perhaps more interested, more engaged with the subject. And so that's why we are keeping a very close eye on the data as we move forward. And we're going to at some point have to make this switch, and we'll keep you updated when we make this important transition. But it's still important to remember that the data you're providing us and we're analysing is as crucial as ever. And we have unrivaled data, totally unique, on the effectiveness of vaccinations in the real world. And we're going to continue this research around this topic and keep bringing you information about infections post-vaccination, side effects, symptoms, and general effectiveness, and when these vaccines are going to run out and you're going to need boosters. So really important, and do stay logging with us. Let's look internationally before we give a greater breakdown of our own data, again just to put our figures in some context. We're still running around amongst the highest rates in the world, although again, as we discussed, we are testing more than anyone else, but this is per head of population. But we're starting to see other countries catching up. It's interesting, Israel's rates are increasing, and they had even more vaccinated people than we have. We're seeing France increasing and the USA. But we're seeing dramatic increases in Spain, which look set to overtake the UK within a few days. Countries like Italy are remaining fairly flat. And vaccination rates in some of these other countries are slowing down faster than they are here, and the Delta variant is taking hold of those countries. So I think we are going to see rates increasing in many countries across the board in the next few weeks. And these countries with increasing rates would do well to look at our experiences, because we've been several weeks or months ahead of them, particularly with the type of symptoms to look out for in a largely vaccinated population that some governments are slow to pick up on. And by missing them, we're losing a lot of chance to suppress infections. Now we're going to move on to symptoms. And it's interesting that as the UK is now testing 3 to 5 times more people than virtually any other country in the world per head of population, naturally we're going to be picking up lots of asymptomatic cases, and we need to be cautious of this data compared to other countries. And this also brings up the point, are we wasting tests? Are we wasting these valuable PCR tests on contact pings rather than testing people with these severe cold or flu-like symptoms? that you've been reporting to us. So do look out for any of these new symptoms, and because the government advice unfortunately still hasn't changed, and a considerable proportion of people who are testing positive are telling us about symptoms that don't include the classic ones, and so would have been missed if they weren't able to get a test through Zoe and they'd tried to get it through official NHS channels. So do report on the app if you feel unwell, get a test, but in general spread the word that if you feel like you've got a bit of a cold, a runny nose, under the weather, this could be a clear sign of infection. And as always, we're giving an update on the latest symptoms in the last 30 days. They are similar to last week's, and generally it's a picture in, if you've been fully vaccinated, as most of you have, it's a runny nose, headache, sneezing, sore throat, and loss of smell, in that order are what people are reporting. And fairly similar with the unvaccinated, with the difference of fever and cough coming in at numbers 4 and 5. We haven't got time to talk about it today, but long COVID is always on our minds, and obviously we are getting hundreds of new cases produced every day, and you can tune into a webinar that I hosted with my colleagues, Professor Emma Duncan and Dr. Claire Steeves from King's College London, where we're talking about some of these studies, and you can register on the link below. And finally, what about test and trace? Is it working? I know all of you have opinions on this and have been sending me your opinions via Twitter or email, and many of us have been affected by this so-called Pingdemic. That's getting a notification from the NHS test and trace app. That's the COVID app, not the standard NHS app, to be clear, that you've been in contact with someone who's tested positive and need to isolate. Now, we've seen lots of news reports of hospital staff being told to switch them off, ban them, and it's put huge strains, closed down supermarkets with cashiers who are exposed to hundreds of people every day having to go off, and pubs, people in constant contact. And the government advice has been somewhat unclear on this, about whether you have to isolate, it's advisory to isolate, and it's difficult for you to know what to do. And they've tried to clear it by saying that if you are pinged by the app, it's advisory and you're not legally obliged to do so. But if you are contacted directly by someone from the NHS test and trace team, you must isolate. So there's still a lot of confusion, as you can see here, and we lack data, and that's exactly where the Zoe app comes in handy. We can find out, and that's why we want to know how effective this system is, how many people who are pinged actually go on to have any symptoms, test positive, etc. How many people is it helping, and is it worth that enormous cost and burden on the economy? And you can tell us, and that's why we want you to go to the app, and when you're asked about this, please do fill it in and get others to download the app, even if it's just to fill in this question. We think it's really vital because it could be a lot of tests, and people's time could be better spent elsewhere, and taxpayers' money. But we need data. We can't just speculate. So head to the app and fill it out. So I think in summary, we're still seeing cases rising, and at the same time we've been given more freedom, but do act responsibly and stay safe. COVID hasn't gone away. It's not going to anytime soon. Spread the news about the new symptoms, please. We've written a blog about top tips about staying safe, and that's linked in the description. Do help us to keep logging daily. Share it with someone who hasn't heard about the app, please. Your contributions are actually absolutely crucial, particularly at this time where we're in so much unknown territory. Keep an eye on our website and others for updates. Click the like button and say yes for notifications so you know when the latest hot video is coming out. And that's it from me. Stay safe and keep logging. Thank you.